My name is Nicoletta and I'm going to talk about the effects of aspirin for primary prevention in persons with diabetes mellitus. Definition: Diabetes mellitus is associated with an increased risk of cardiovascular events. Aspirin's use reduces the risk of occlusive vascular events but increases the risk of bleeding. The balance of benefits and hazards for the prevention of first cardiovascular events in patients with diabetes is unclear.
What is diabetes mellitus? Normally, after we eat or drink, our body will break down sugars from our food and use them for energy in our cells. To accomplish this, our pancreas needs to produce a hormone called insulin. Insulin is what facilitates the process of pulling sugar from the blood and putting it in the cells for use or energy. Diabetes mellitus occurs when insulin production is deficient. This results in a high level of blood sugar in the body. Without insulin in our body, glucose cannot enter the body's cells and is excreted through urine, which results in its loss. An increase in blood glucose concentration leads to loss of water in cells via osmosis to blood. To understand what happens in a diabetes patient, we need to understand what happens in the normal mechanism. Whenever the blood glucose level increases, the pancreas responds by secreting insulin. Insulin has two functions here. It converts glucose to glycogen and increases the metabolism of glucose in cells. This is how the glucose levels fall and the blood sugar level goes back to normal. The pancreas will secrete less insulin when the blood sugar level is low. It decreases the glucose metabolism and gives the chance for sugar level to increase and return the blood sugar level to normal. People with diabetes are having problems in their pancreas. It produces inefficient insulin, or none at all, halting its effectiveness to process of glucose. This causes blood sugar level to arise from the lack of glucose metabolism. Meanwhile, the rest of the cells are in need of the energy but are not supplied any. The cell's deprivation lead to wide problems in nearly every major body system. Types of diabetes. Diabetes has two main types, type 1 and type 2. Type 1, also called juvenile diabetes or insulin-dependent diabetes, is an immune system disorder. Our own immune system attacks the insulin-producing cells in the pancreas, destroying our body's ability to make insulin. With type 1 diabetes, one must take insulin to live. Most people are diagnosed as a child or young adult as if it is inherited. Its symptoms include frequent urination, thirst, fatigue, insulin shock, and diabetic coma. Insulin shock can be described as a feeling of dizziness, sweating, and paleness. Diabetic coma can be described as partial or complete loss of consciousness. Type 2 is related to insulin resistance. It is usually suffered by older people, but lately, this type occurs more frequently in younger people. Obesity is the prime risk factor of type 2 diabetes. Type 2 diabetes is mostly a result of poor lifestyle, dietary, and exercise habits. Its symptoms include blurred vision and fatigue. Prolonged insulin resistance in type 2 diabetes can eventually lead to beta cell in pancreas to atrophy and stops producing insulin effectively. Insulin medication must be needed later on.
Applications in medicine. We randomly assigned adults who had diabetes but no event cardiovascular disease to receive aspirin at a dose of 100 milligrams daily or matching placebo. The primary efficacy outcome was the first serious vascular event. Aspirin is the most widely used drug in medicine. In 2007, the Agency of Healthcare Research and Quality reported that nearly 20% of adults in the United States report taking aspirin daily or every other day, with this number increasing to nearly 50% in those aged 65 and older. Aspirin is also one of the oldest drugs in use, with a history dating back to the periods of Hippocrates and Galen, when the bark of the willow tree was famous for its analgesic and anti-inflammatory properties. Pros and cons. Pros: reduce the risk of cardiovascular problems in people who had already suffered. Cons: gastrointestinal bleeding, liver disease, clinical active, a stroke caused by a blood vessel bursting. Much of the ongoing controversy regarding the utility of aspirin for prevention of cardiovascular disease surrounds its use in patients with diabetes. Individuals with diabetes have a 2 to 4-fold increased risk for serious cardiovascular events as a result of increasing coronary thrombus formation, increased platelet reactivity, and worsened endothelial dysfunction. Cardiovascular outcomes were compared in patients given 650 milligrams of aspirin daily versus placebo as a secondary study outcome. A significant reduction in fatal and non-fatal MI was observed in the aspirin group.
Your heart pumps blood to your entire body through a network of blood vessels known as the circulatory system. Your blood supplies the cells in your body with the oxygen and nutrients they need. If you've had a heart attack, or stroke, or have angina, peripheral arterial disease, or coronary artery disease, your doctor may prescribe you aspirin. Aspirin reduces your risk of blood clots. A blood clot is made up of fibrin, long strands of protein that form a net. Platelets and cells clump together and stick to this net, forming a clot. Aspirin interrupts the clotting process by stopping an enzyme called COX-1 from working. This interruption makes platelets and cells less sticky, so they can't clump together and form a clot. The BHF is funding a clinical trial to find out how long patients should take aspirin after a heart attack. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health. For more information about aspirin, visit bhf.org.uk/aspirin.
Issue applied in Ecuador. In Ecuador, diabetes is affecting the population with increasing rates. According to an ASUD survey, the prevalence of diabetes in the population aged 10 to 59 years is 1.7%. The proportion goes up from 30 years of age and at 50, 1 in 10 Ecuadorians already have diabetes. Patients with diabetes mellitus have a risk of vascular event that is 2 to 3 times as high as the risk among those without diabetes, but most of the estimated 4,000 million persons with diabetes worldwide do not have manifest vascular disease.
Well, I think this is a very difficult question in a way because we have to really try to estimate the risk of patients with diabetes. As far as we know, the guidelines, practice guidelines are very controversial on this issue. There are guidelines who are very pro the use of aspirin in patients with diabetes, so in a liberal way, and other guidelines which are more concerned of the assessment of the risk. So patients with type 2 diabetes have a certain degree of risk, but within this category of patients, there are patients with a higher risk, and they for sure are entitled to have aspirin in primary prevention. We have tried to investigate in different trials. The most recent one, the ASCEND trial, was trying to assess the importance of having aspirin in primary prevention in patients with diabetes, but still we are left over with this uncertainty because of the balance between the benefit and the bleeding risk, which is there. And so I think we have to have a conservative approach and try to dissect the risk of a patient to the best of our possibilities.
Conclusion: aspirin use prevented serious vascular events in persons who had diabetes and no evident cardiovascular disease at trial entry, but it also caused major bleeding events. The absolute benefits were largely counterbalanced by the bleeding hazards. Thank you.